بسم الله الرحمن الرحيم. أنا دكتورة عبير عبد الرحمن يمني، ودي المحاضرة العاشرة لكورس الإلكتروثيرابي under the title Electro Corporeal Shockwave Therapy. The objective of these lectures are: define the meaning of extracorporeal shockwave therapy, be acquainted with the principle of shockwave production, distinguish between the different types of shockwave therapy, understand the physiological effect and the mechanism of action of the extracorporeal shockwave therapy, its adverse effect, identify indication, contraindication, dangers, and precaution of extracorporeal shockwave therapy. The extracorporeal shockwave is defined under the acronym of ESWT. It's mean application of pressure, high pressure mechanical wave, and this application from outside the body, so it will be called extracorporeal, that violently suddenly impact the biological tissue, so it will be give a shock for the tissue, and this is shock for therapeutic purpose. The scientists invade the extracorporeal shock wave as an alternative non-invasive therapy to the surgery for a chronic condition not responsive to a treatment, like a tendinopathy, injury to the tendon. It will be follow from acute trauma to chronic due to chronic overuse, and for a delayed union fractures by enhancing stimulating the healing process of a tendon or a bone. يبقى الاكستراكوربونري شوك ويف ثيرابي بدأت فكرته as an alternative non-invasive therapy for the surgery in chronic case like chronic tendinopathy. This either tendinopathy can come from acute stage or from chronic overuse, and a delayed or non-union fractures of the bone to enhance the healing process of the tendon. The extracorporeal can be defined as low or high amplitude wave formed by sudden mechanical compression of the medium through which the ultrasound or the mechanical wave move. It is low or high amplitude formed by sudden mechanical compression of the medium by this wave. A shock wave is a single acoustic wave characterized by rapid rise to a high peak pressure, rapid rise to a high peak pressure, followed by rapid drop below the ambient pressure. This is the ambient pressure, or below the baseline of the pressure. They are sent to affected area from a point of contact on the skin surface. So this is a direct contact between the head of the applicator of the extracorporeal and the skin. This wave of the extracorporeal is characterized by positive wave and the negative wave. The positive wave, what is called positive energy or compressive phase, and this compressive phase cases shear stress in the tissue. And negative energy wave or tensile phase, and this is cases cavitation bubble inside the tissue. This is a relaxation phase. واتكلمنا ان الكافيتيشن formed by rarefaction of the molecules during the propagation of the ultrasound or sound wave through the tissue. There is a high peak positive pressure can be measured by the distance from the baseline to the highest point above this baseline, and it will be generate positive peak pressure. And cases compressive phase of a shock wave. And negative peak pressure, on the other hand, related to the maximum negative peak pressure extended during the tensile phase of a shock wave, and it is measured by the highest peak line between the baseline and below this baseline. The pressure is commonly measured by megapascal or bar, and 10 bar is equivalent to 1 megapascal. Tensile pressure amplitude are equivalent to approximately 10% of the positive pressure. Characteristic of a shock wave as positive peak or negative peak, there is also rise time. Rise time, it is the time taking for the positive to reach a positive peak pressure, يعني time from the baseline to the highest point, to reach the highest point. This is the rise time. And the pulse duration, it is the duration of a pulse of positive peak. Rise time is defined as the time interval during which a positive pressure rises from baseline to a peak value. The pulse duration is defined as the interval between the beginning and the ending of a compression phase اللي هو positive phase, and it measured by a micro or a millisecond. الويف characteristic of extracoronary shockwave therapy بتتميز بإيه؟ بالبيك بريشر. البيك بريشر ده it will be ranged from 50 to 80 megapascal, and the other device can be 35 to 120 megapascal. Fast pressure raise time, pick up time, usually it less than 10 nanosecond. A duration, it is very short duration, usually 10 microsecond. And narrow effective beam, البيم size of the effective beam, it will be very narrow, it means 2 to 8 millimeter diameter. Energy and energy flux density of a shock wave. The mechanical or acoustic energy contained in a shock wave is expressed in a millijoule. What is meant by energy flux density? Is defined as the amount of mechanical acoustic energy per unit area per shock. هو energy flux density. Energy over the surface area of the hand of the ultrasound of the shock wave application. Energy flux density is measured in millijoule per square millimeter and may be classified as low energy flux density or medium or high. Low, it will be up to 0.08 millijoule over square millimeter, and it is usually used for cell repair and regeneration. medium up to 0.28 millijoule per millimeter square, and commonly used for pain theory or relief of pain. Highest energy, it will be over 0.6 millijoule per millimeter mercury, and it will be used in the range of non-union fractures of the bone. Production of extracoronary generator. There are four type of generator produce extracoronary shock wave. It will be electrohydraulic, electromagnetic, piezoelectric, and parasitic. The first three generator rest on conversion of electrical, depend on the conversion of electrical energy to mechanical energy, and generate focused shock wave. The fourth, called parasitic, rest on pneumatic principle and generate radial shock wave. This is a shock wave discharge, piezoelectric, electromagnetic, produce focus, and it will be depend on what is called a conversion from high to specific point. In pneumatic, it will be produce diversion, radial shock wave, and depend on phenomena of diversion from a specific point to wide diffused point. A device of the shock wave can be focus زي ما قلنا focus extracorporeal shock wave, focus surface area high energy. It will focus to small target area, and it is called conversion. While the other part, what is called radial extracoronary shock wave, focus point provide wide field of application, and it is cannot be local for local area, and depend on phenomena of a diversion. The device can be high energy focused extracoronary shock wave، نقول عليها الهارد shock wave، or low energy radial extracoronary shock wave بنقول عليه soft shock wave. And other device has a combined type. Applicator of extracoronary shock wave. Various applicators are used to deliver either the focus or a radial extracoronary shock wave. There must be coupling medium, as an extracoronary is a sound wave, mechanical wave. There must be conductive medium between the head of the device and the applicator tissue or the point of the application. A coupling medium is required for mechanical energy created by the shock wave to transmitted and absorbed by the soft tissue، لأن احنا عارفين في high impedance or high acoustic impedance for a transmission between the air and soft tissue. A suitable dome membrane that are filled with either gas, water or gel bag يعني filled by either gas, water or gel are used as a coupling medium with a focused type. While a radial type can be used in standard gel as a gel used for ultrasound application. This is the device of the focus, provide high intensity, high energy, pressure of an extracoronary. It will be focused from a broad area, generator focused into local area. The radial focused produced by small area, depend on a diversion, and produce little or low energy. When I comparing between الfocus and الradial about the generator, all type or most 3 type اللي هو electrohydraulic والelectromagnetic والpiezoelectric produce focus while الparasitic produce irradial. الpropagation depend on what الconversion اللي هو الfocusing while الradial depend on الdiversion. penetration depth because it is will be focal, so it will be deep penetration more than 5 centimeter. Because it is depend on a diversion, so it will be less penetrated less than 5 centimeter. يبقى لو أنا عندي deep lesion هستخدم الفوكال، لو أنا عندي superficial region هستخدم الراديال extracoronary shock wave. And this is the other parameters for the comparison between the focus and the radius. Compression pressure up to 120,000 megapixel، لكن ده هنلاقي ان الcompression pressure 0.5 megapixel. التنسايل pressure الopposite pressure it will be equal، يعني هنا بس اللي هو البوزيتيف pressure هو في different في عشان كده في الهاي peak pressure applied to the tissue. الريز تايم هنلاقي ان هنا high intensity الريز تايم is very small، هنا هنلاقيه is large. البالس duration هنلاقي small pulse duration، هنلاقي long pulse duration في ايه في الراديال، long pulse duration في الفوكس short pulse duration. الcoupling medium كبالون ممكن be filled by water or gas، لكن في الراديال can be used الاكوستيك جل النورمال اكوستيك جل. الابليكاتور بيبقى bulkier and more difficult to manipulate، صعب جدا ان انا اتحكم فيه، لكن هو بيبقى كبير، لكن في الراديال small and easier to manipulate or to be used for to apply shock wave to patient. It offers local anesthesia often required to prevent the pain during a treatment. I must be used local anesthesia لأنه بيبقى بفوكس فبيبقى painful جدا جدا، بيعمل irritation للبين receptors، ف it can be used analgesic drugs after application، لكن في الراديال because it is will be diffused no need to use any analgesic. indication ده بيبقى for small more focused and deep area، لكن الراديال بيبقى for large less focused and more superficial area. This is the difference in the parameter between الفوكس and الراديال. ده هنلاقي البريشر high pressure من 100 ل 1000 بار، دي من 1 to 10 بار. البالس duration short pulse duration، دي هنلاقي more longer pulse duration. البريشر فيد هيعمل focusing، ده هيعمل radial or diversion. البنتريشن depth مادام في focusing يبقى في large depth of penetration، ده هيبقى ايه less depth or superficial penetration. most commonly affect the cell، لكن الراديال most commonly because it is diffused it will be affected tissue، لكن الفوكس it is more localized so it affect the cell. Physiological and therapeutic effect of extracorporeal shockwave therapy. Both the focus and the radial shockwave produce the same effect. It will be differ in intensity and localization. The delivery of mechanical or acoustic energy contained in the shockwave cases microtrauma. الهاي energy بيعمل microtrauma so it will be pro-inflammatory، enhance the inflammation of the tissue for accelerate the healing. لما يكون في عندي chronic case، عندي case not response for any treatment، I will be initiate the process of the cure or the process of the healing but from the first stage، so it will be initiate the inflammation or going reversed this case to inflammatory stage for الcuring. فالأكوستيك or الشوك ويف therapy use high intensity to produce microtrauma, to produce energy to the tissue, which create fresh micro injury within the target soft tissue. These micro injury are presumed to stimulate the expression of an angiogenic growth factor and in growth of a new vascularization. يعني أنا برو inflammatory، أنا بحاول بستخدم التشوك ويف عشان يعمل inflammation for the tissue by microtrauma, and the process of an inflammation it will be aggravated and enhance the healing of the tissue by angiogenesis, the formation of new, and the stimulation of a growth factor in this tissue. These biological effects are presumed to increase the blood supply, which promote soft tissue repair in case of chronic tendinopathy and delayed fractures of bone. This is the most common indication for extra. We can summarize the extracorporeal shock wave as it will be mechanical energy. This mechanical energy can be generated in two forms: radial extracorporeal or focused extracorporeal. Diffused, localized, low intensity, high intensity. Less penetration, more penetration. Both of them it will be produce microtrauma for the tissue. This microtrauma it create fresh micro injuries, and micro injury stimulate the expression of an angiogenic growth factor. Also it will stimulate the ingrowth of new vascularization. Both of them increase the blood supply and promote tissue repair, which can at the end heal a chronic tendinopathy or non or delayed fractures of the bone. Indication can be indicated for shoulder impingement or frozen shoulder, for carpal tunnel syndrome, trigger finger, Achilles tendinopathy or tendinitis, inflammation of التندو Achilles. البانيون اللي هي فيها bone at the big toe, plantar fasciitis. shin splints بيبقى فيه pain especially in football player، بيبقى فيه chin or fissure fractures in the chin of the tibia. Tennis elbow and golfer elbow. This is the most common indication of the extracorporeal. The contraindication must be don't apply to sensitive or air bag structures زي lung tissue appear to be damaged unequivalently and should be avoided. عند الابيفيزيال بليت لانه destructive it is high mechanical energy. اما بنقول الالترا ساوند هي اعلى من الالترا ساوند، يبقى الابيفيزيال بليت can be destructive by extracorporeal، يبقى ده contra indicated. coagulated disorder في حالات الهيموفيليا، اليوز اوف الانتي كواجولانت drugs البيشنت اللي بيستخدم انتي كواجولانت لان انا بعمل مايكرو تروما so enhanced bleeding especially لما يكون ايه ماكرومار. لو كان في ثرومبوزيس history of thrombosis، طبعا tumor disease carcinoma patient is contraindication ان انا استخدم على السايت اللي فيه carcinoma tumor tissue لانها enhance ال growth factor to this tissue. ال pregnant woman طب contraindication either applied ال shockwave على اليوترس او على الباك it will be completely contraindicated. child in growth لأنه قلنا في الابيفيزيال بليد it is contraindicated. cortisone therapy for 6 weeks before the first extracorporeal لأن الكورتيزون بيعمل water retention والwater retention it will be decrease the effect of high water content inside the body, it will be decrease the effect of extracorporeal. فلازم يكون على البيشنت الكورتيزون at least 6 weeks. What is the adverse effect? الادverse effect there can be minor skin irritation. أنا بعمل micro trauma للسكين so it can be produce skin irritation, sometimes numbness or paresthesia, but it will be temporary at the time of immediately after the time of a session, and after that it will be removed. I can't use any extracorporeal session until all the sign or adverse effect of shock wave it will be subside. طب ايه ال possible adverse effect؟ ممكن يحصل swelling، ممكن يحصل redness، ممكن يحصل هيماتوما، يحصل batching، يحصل pain. مقدرش لو في اي sign من دول موجودة مقدرش استخدم للعيان جلسة الا لما يكون ال5 sign دول مش موجودين. عشان اعمل application لازم احدد الدوزومتري، لازم نحدد النمبر اوف تشوك، ولازم اعمل التوتال تريتمنت سيشن ريبيت. التشوك النمبر بيكون between 1000 to 1500 و other authors suggested ان انا ممكن ارفع التشوك نمبر ل 2000 per session. The number of treatment session most clinical research has used between 3 to 5 sessions at low energy level اللي هي ايه الراديال and suggested up to 7 in some cases. A typical session is spaced such as to let the tissue reaction at least partly subside from the first session before the next treatment is delivered. يعني ما اقدرش ادي العيان session الا الادفيرس effect لو اي واحدة من الا adverse effect subside and not appear and the patient cannot complain from the adverse effect of the first session. هنا في حالات ال trigger point or حالات الكالكينيوس سبيرن or plantar fasciitis how can be applied. I will be detect الكالكينيوس سبيرن by palpation وبعدين بعمل له detect by pointer erase pointer applied الجل then I will be selected either ان انا هستخدم ال radial extracorporeal or ال focus extracorporeal according to the case according to evaluation. If there is any question don't hesitate to contact us.